Shockwave therapy is a newer treatment to help get tendons and ligaments to heal. It's been used in the past for very specific ligament injuries like Achilles tendonitis and plantar fasciitis. It's going to send a mass amount of energy right at the injured tissue to basically break it up, to damage it, to trigger its healing processes to come back in and create more of the proper tissue that should be there. So you've heard people say with chronic plantar fasciitis, they walked in for treatment, but then they limped out. They were too sore, their foot swelled up, and they were really in a lot of pain for a week or two, and then they started feeling better. Well, what happened is that amount of energy overwhelmed the tissue, caused excessive pain, excessive inflammation, but it did trigger the healing mechanisms to come back in and get proper repair. Now, we don't want to go down that route, so the newer Shockwave equipment is a little bit better, and that spreads some of that energy out. It's not quite so focused, causing excessive pain, excessive damage. So we're going to use that Shockwave therapy on all chronically injured tendons and ligaments to help go through their repair and healing process. It's going to feel kind of like a thumping. You're going to feel that pound, pound, pound into the tissue, and that's that sound and wave energy coming to hit the fibers, which are going to shake it, break it, tear some of the fibers, but trigger some of the healing to come back in. We're not going to overwhelm the tissue with excessive amount of energy, causing that massive pain and inflammation. We're going to tone it down so that we get the proper amount of healing over a comfortable period of time.